Thanks very much. What I want to do today is to talk about the experience of Ayrshire and Arran and some of the things we've achieved so far, and in that respect I'm speaking on the behalf of the three partnerships, but I also want to make specific reference to the work that we've done within North Ayrshire Partnership. For the past 2 years, nearly 3 years in fact, we've been talking about integration in Ayrshire. The discussion has been based on our experience to date within Ayrshire. For example, in East Ayrshire in developing joint learning disability services, in South Ayrshire in developing an integrated OT pathway, and in North Ayrshire in terms of co-location around general practice. And from previous experience as well, for myself and Tim Eltringham, who's the Chief Officer of South, we both worked within Greater Glasgow, and for myself as previously the Joint Manager of Glasgow Addiction Service. We know that it can work. We've seen the evidence in Greater Glasgow and Clyde Community Care and Health Partnerships and in Glasgow Addiction Services. So, in 13-14, we had the debate, a corporate model versus a lead partnership, adult services versus all social work services. We decided on a corporate model and we decided on all social work services. The chief officers were appointed in 13-14. In 14-15, we established our shadow boards from the outset, including all of the stakeholders. We recruited our senior managers from the NHS, from the council and from the voluntary sector. We developed our integration scheme jointly as one Ayrshire with local variation. We developed our strategic plans. We have used our integrated care fund to develop a change plan. And on Thursday the 2nd of April, we will each have the inaugural meetings of our integrated joint boards. Yes. We could not have achieved all of this without two key factors, leadership and collaboration. From the outset, our elected members embraced the change. They saw it made sense from the point of view of the public, and they recognised the opportunity to influence health priorities. Our 4 chief executives worked collectively to provide the leadership we needed, giving us permission to get on with it. We adopted a clear programme approach, meeting every week, focusing on the tasks we needed to complete together, led by our colleagues in NHS corporate planning, but dependent too on our colleagues within the councils and the rest of the NHS, particularly in relation to finance, HR, IT and the legal work. In fact, in totality, it was a mammoth team effort across Ayrshire and Arran. The chief officers collaborated to develop our management structures and appoint our teams, and our shadow board brought together non-execs, councillors, staff side, third sector interface and independent sector, and the service users and carers. And they've worked really hard to get to grips with this fast-moving and complex agenda. But it's not just about the two big monoliths of the statutory sector coming together. This is about taking the opportunity to do things differently, to work with a range of stakeholders with an interest. With our staff, we are working to establish a new way of involving both NHS and council trade unions, bringing together two very different traditions. Our third sector interface and independent sector colleagues have been heavily involved in writing the strategic plan, in consulting through their constituent agencies, and in administering our Ideas and Innovation Fund, funded through the Integrated Care Fund. After all, half of the social work budget funds services in the third and independent sector. And as we go through the change programme, we need to develop different ways of working together, moving away from the traditional purchaser-provider relationship. But most importantly, I want to pay tribute to the role of our service users and carers. Not only have the Public Partnership Forum contributed to the debate around the strategic priorities and made sure that their views were heard, but also our peer researchers, a group of trained volunteer service users, have hit the streets of North Ayrshire, asking 300 members of the public what they think of our draft priorities and the way we have set out our plan. So what are our priorities? From the outset in this discussion with many staff, service users and carers, we've been clear that the most important emphasis within the legislation has been about being seamless from the point of view of those who use our services. And when all the arguments are upped and everybody wants to defend their corner, that probably is the most important line for us. Our carers have been very clear about their experience of health and social care. They are fed up being the only ones who know the whole story, who have to navigate the travails of our services. They want better joined-up care, and they want us to coordinate it better and share information and plans. So, joining up the NHS and Council services for addiction, mental health, learning disability and older people will be one of our first priorities, as will be developing better care coordination and a named approach for adults. We have been working with our GPs to look at how we can join those services together around our practices, developing community connectors based within practices and clearly aligning the rest of our teams with the GP as the lead medic. 6 practices have volunteered so far in North Ayrshire. I think there are more in East and South, and this will focus initially on older people but also extend to mental health. We've been working with colleagues in education and Police Scotland looking at teams around children in early years, primary and secondary schools. We all have already had a number of award-winning initiatives with the police, seeing reductions in domestic violence for the first time in many years in Ayrshire. Our public health colleagues have completed a strategic needs assessment around adverse events for children, and we have built on this, working with Dartington Social Research Company, and now have a much clearer picture of priorities for children. Over the summer, we will develop our multi-agency redesign programme involving our social workers, our health visitors, our school nurses and our child and adolescent mental health staff. And on mental health and wellbeing, our peer researchers were clear. The resounding message from the public of North Ayrshire is that mental health and wellbeing matters for all ages. This was the area where we saw the biggest difference between the priorities that we had identified and the priorities of the public. Mental health and wellbeing was a priority, but for the public, for 100% of those asked, it was the top priority. So what have we learned so far? Do not make assumptions that we're all talking the same language or mean the same things. It's important to recognise that we all view this agenda through our own particular lens. Collaboration means that you do not always get your own way with every issue, and we've learned to live with that. We're grateful to our colleagues in the third and independent sector for the significant work that they've done on the Ideas and Innovation Fund. And we have been immensely impressed by the response of our staff across the partnership. We have more ideas for change than we can handle at the one time. We have been surprised at the number of people who want to get involved. Of the 300 interviewed by our peer researchers, 77 have indicated that they want to stay involved in this discussion. And I'm very proud of our service users and carers for getting involved, challenging our assumptions and reminding us that this is about a dialogue. This is only the start of the story so far. There is much more hard work to do. We're very clear about that in Ayrshire and Arran, but we are prepared to do that hard work. Thank you.